which affects almost 30% of the Indian population.
He'll be complaining of pain.
Is there any exercises that you advise your patient
So strengthening of those muscles is very important,
so that they can do it at home as well?
like in lifting his knee and holding it there for 10 seconds, then relax.
Jai Shri Gurudev. Namaste and welcome to BGSMCH Aarogya Vani. Your health, our priority. I'm your host Dr. Anu. In today's episode of Aarogya Vani, we are exploring a very essential aspect in the management of osteoarthritis knee, physiotherapy. Osteoarthritis is the most common form of arthritis, which affects almost 30% of the Indian population. Osteoarthritis of knee happens when the cartilage in the knee joint wears off over time. A patient of osteoarthritis knee presents with complaints of pain in the knee joint, restriction in the movement, and stiffness in the joint. While pain medication and surgery are the widely recognized treatment of osteoarthritis knee, physiotherapy has a very crucial role to play. To help us understand better regarding the role of physiotherapy in osteoarthritis knee management, we have with us today our senior physiotherapist from BGS Medical College Hospital, Ms. Siri. Hello Ms. Siri, a very warm welcome to BGSMCH Aarogya Vani.
Jai Shri Gurudev.
Jai Shri Gurudev.
Thank you for inviting me to this Aarogya Vani.
So to start the discussion, can you please explain the role of physiotherapy in management of osteoarthritis knee?
Of course, ma'am. As I've already mentioned, osteoarthritis is the degenerative disease seen in India, which is the most common disease. And it is the 11th leading disability worldwide. Physiotherapy plays a very crucial role in managing and treating the osteoarthritis of knee. Usually when a patient comes to us, he'll be complaining of pain. Our focus is a patient-centered approach. So when a patient comes to us, we'll be focusing on reducing the pain first because it is the main priority for the patient too. And also we'll be focusing on improving his quality of life and making his daily activities better.
So reducing pain is the most needed reason why patients approach a physiotherapist, right? What are the modalities that you adopt to manage osteoarthritis knee?
We have various modalities in physiotherapy. Starting from a basic hot pack at your home, we'll be using IFT or interferential therapy, ultrasound therapy and shockwave therapy to reduce pain.
So you already explained regarding the modalities of treatment in physiotherapy, basically ultrasound therapy and interferential therapy. Is there any exercises that you advise your patient that you make them train so that they can do it at home as well?
Exercises plays a very crucial role in reducing the pain. Usually patient thinks like going to a physio, they'll just provide current and that will reduce their pain, but it's not. Exercises are very important and the knee joint is surrounded by quadriceps muscles and hamstring muscles. So strengthening of those muscles is very important so that the load taken by the knee joint is reduced and it will be divided among those muscles. So talking about strengthening of muscles, we have isometrics of knee extension exercises and knee ROM exercises.
So you mentioned 3 types of exercises basically. Isometrics of the knee, then strengthening exercises, knee extension exercises and range of motion exercises. Can you please explain what is this isometrics of the knee or how is it performed?
Isometrics of knee is performed when patient has to be in a lying position. A roll towel should be kept underneath his knee and the patient has to press that towel for 10 seconds. He has to hold it for 10 seconds, then relax. It can be repeated for 10 repetitions.
Okay.
Then we'll change the position of the roll towel underneath his heel, where he'll be pressing from his heel for 10 seconds and repeat for 10 repetitions.
So now you explained about the isometric exercises. Then you also mentioned about extension of the knee as well as range of motion exercises. Can you please explain?
For knee extension exercises, patient has to be in high sitting position where his back has to be straight. It should not be bent. It has to be straight. And he'll be extending his knee, like in lifting his knee and holding it there for 10 seconds, then relax. Lifting it up, hold it for 10 seconds, then relax. This is the knee extension exercises we usually free.
What about the range of motion exercises?
Range of motion exercises, patient has to be, it can be in supine or lying position and side lying also, where the patient will be performing knee flexion exercise. He will be bending his knee to his pain free range and as well as extending his knee. Performing the ROM, range of motion, from knee flexion to knee extension, it will be 10 repetitions.
Siri, now you explained the various exercises that you train the patients who approach you with osteoarthritis. There are a lot of YouTube videos that are available regarding muscle strengthening exercises. So there is a normal tendency that people will watch the video and try to do those exercises so that they can get relief from the pain or improve the stiffness and increase the range of motion. So what do you suggest? Is that an appropriate strategy, or you advise that the patient should do these exercises with the supervision of a physiotherapist? What is your suggestion?
There is no one size fits all. Same exercises cannot be recommended for everyone. So individual approach should be done. When you visit a physio, we will be doing an individual assessment. Then we will be planning the treatment protocols according to their needs. So visiting a physio is very much important. For example, a person with flat foot, he may have knee pain. So more load will be on the knee joint. First, if we focus on correcting the flat foot first, the load on the knee also will be reduced and the pain also can be decreased. Based on that aspect, visiting a physiotherapist is very much necessary.
So physiotherapist will assess the patient and stage the disease and accordingly advise the exercise. It's not that whatever exercise, that video that they are saying might be applicable to them. It's not like that, right? So as community medicine faculties, when we go to the community, we hear about many beliefs about diseases. So one of the belief about osteoarthritis is that exercise worsens osteoarthritis. Is it correct? What is your opinion on that?
Patient comes to us and he'll be asking us with the same question, whether the exercises will worsen the knee pain or whatever. But patient also thinks about taking the rest. Whenever he gets pain, he'll be thinking of taking the rest. But in the initial few stages, what is the first 1 to 3 stages, exercises are very, very important in the first 3 stages. But in the 4th stage, if you see, the severity will be more. And if you do the same exercises in the 4th stage, it might worsen the pain. And also people think of squatting will be good exercises for ONE. But for a patient with ONE, if we focus on modifying the exercises like wall squat or partial squat, it might improve the pain.
Okay, so it's not that exercise worsens OA, but might be unsupervised exercise.
Yes.
Worsens OA. So at any stage, as you previously explained, it's not that one exercise will be applicable to all the patients of OA. Okay. Another common belief is that osteoarthritis is a disease of old age. Is it true? What is your experience regarding that?
People usually think that osteoarthritis is a degenerative disease and it will be affecting only the older age group. But based on my experience, what I have seen, people with the age of 40 years to 45 years, even they complain of knee pain and they'll be diagnosed as osteoarthritis. So usually based on, like, if you take for example, females in a premenopausal stage, there will be more load on the knee. Then also based on, for men, if we take, there will be the factors like prolonged standing and also their improper mechanics, if you see. Then also obesity. It might put more load on the knee and they will be complaining of knee pain that leads to osteoarthritis.
Okay, it's not just aging then. There are other factors like posture you told, mechanics you told, hormonal problems that lead on to osteoarthritis. Okay. So is there any role of physiotherapy in preventing osteoarthritis?
Prevention is better than cure. Physiotherapy plays a preventive role in managing osteoarthritis. As we have already mentioned, improper mechanics, there will be lot loading in the knee joint. We will be focusing on strengthening of weaker muscles and stretching of tighter muscles. And then the posture imbalance, we will be focusing on posture correction, which helps. Then also at last the obesity. We will be focusing on weight management and weight reduction, which can help in preventive role.
There is role of physiotherapy in preventing the disease, right? So whatever conditions you had told in improper mechanics or improper posture, by correcting that, this progression of the disease or might be the onset of the disease can itself be prevented, right? Okay. So we have covered almost all the concepts of physiotherapy that is applicable for osteoarthritis knee management. At the end, do you have any advice for our viewers who are suffering from osteoarthritis knee?
I'll suggest them to stay active and exercise regularly and maintain a healthy weight, and also don't overload the joint. And you have to be patient with the exercises. You should not think that I'm doing everything but the pain is not subsiding. Be patient with the exercises. Do the exercises regularly and give it some time.
Okay, Siri, thank you. Thanks a lot. Thanks a lot for taking out time from your busy schedule, and spending some time with us and spreading the knowledge about the role of physiotherapy in osteoarthritis.
Thank you for giving me this opportunity to spread awareness among the community, and I thank BGSMCH Aarogya Vani too.
Thank you. Dear listeners, if you have knee pain, please don't consider it as part of aging. Consult a specialist, and if physiotherapy is advised, don't hesitate. It has enormous benefits and it can significantly improve your quality of life. If you found this video helpful, please like the video and share it with your loved ones. For more health insights, subscribe to our YouTube channel, BGSMCH Hospital. With that, we wrap up this episode of BGSMCH Aarogya Vani. Stay informed, stay safe. This is your host, Dr. Anu, signing off. Jai Shri Gurudev.
If you enjoyed this video, don't forget to give it a thumbs up, share it with your friends, and hit that subscribe button for more exciting content.